Just over 7 years ago, I was involved in a serious car accident. I had life-threatening injuries, but fortunately I was airlifted to a hospital in Birmingham where I received life-saving surgery. I have no recollection of the accident at all. I remember waking up in intensive care about 2 weeks after the accident, feeling quite scared at times, but comfortable in that I knew what was going on, even though I'd been unconscious. A member of the nursing staff told me a consultant had sat down with me and gone through all my injuries, all the treatment I'd received and all the treatment and what the future held for me. So I felt quite secure and safe in the environment. My initial surgery was for 5.5 hours, which was life-saving surgery. I had to have my spleen removed, I had liver damage, I had damage to my lungs. I was then in intensive care for about a week before I went in for more surgery, which this time was 17.5 hours, orthopaedic surgery to put my arms, legs, my pelvis and all the other bits back into place. I remember being supported by the whole team. It wasn't just the surgical side, or obviously that was a huge role in my recovery, but I remember physiotherapists, a whole network, a whole huge team that helped me out, physical support, mental support, psychological support. On days that I needed encouragement, then they would encourage me, and days that I just needed a hug and a bit more comforting, they would just come in and give me a hug and comfort me. I recall one evening asking a doctor if I could speak to other patients that had had similar injuries to me so that I could get an idea of what lay ahead of me. And he told me that patients with trauma injuries like mine don't usually survive. And he also said that that's why, how they justify working 24 hours a day and the years of training that they do. Because when a case like mine comes in and it comes out with a happy ending, then it's rewarding for them. I think a new trauma centre in the Midlands is a fantastic idea. We can then start to see more patients with trauma injuries like myself coming through with a happy ending.